Just over a year ago, Virginia reported its first case of COVID-19, and today healthcare workers are reflecting on the changes the pandemic has set in motion. Good evening, I'm Candace Burns.
And I'm Bill Fitzgerald. Our Shannon Lilly spoke with a nurse about her experience on the front lines of this pandemic. Shannon?
Well, Bill, Candace, I can tell you that for most of us, this past year has been unlike anything that we've experienced, but for our healthcare workers especially. In fact, that ICU nurse that I spoke with equates COVID with a lot of death.
On a warm winter day outside the Memorial Regional Medical Center, you may never guess the difficulties faced inside.
It was a lot. It was very heavy. You could kind of feel that weight on the staff in the unit.
A nurse of 7 years and mother. In August, Kelly Jenkins made the transition from doing outpatient work at St. Mary's Hospital to working with COVID patients in the ICU at Memorial Regional.
It's really hard walking into my home and telling my children who are running up to me that, no, don't touch mommy, she's dirty, I have to go take a shower.
But those early months, Jenkins says, didn't compare to the spike seen in January and February.
I knew I would be in the middle of it. I didn't know I would have days where both patients would die in the same 12 hours. I didn't know that I would have days where we would code 5 different people on the unit in the same 12 hours. I didn't know all that.
The hardest part.
It's really hard telling family members that they can't be with their loved one when they're sick. Being the last person at a patient's bedside when they pass. It shouldn't be us.
In the year since the first case of COVID was identified in Virginia, hospitals in the state have treated more than 47,500 COVID patients, according to the VHHA.
Yeah.
For Jenkins, that often equated to about 50% of their 24-bed unit filled with those COVID patients. But in the last couple of weeks, she says things are looking up.
That right now our numbers are down a bit, so it's been a nice kind of breath of fresh air.
With 3 effective vaccinations being administered,
so I think it's important.
VCU infectious disease epidemiologist Richard Wenzel expects that trend to continue.
But I think we will have herd immunity certainly by the fall, hopefully even in the summer.
And with that hope on the horizon, Jenkins says she's seen good come from hardship.
It has built stronger people. I think it's built stronger healthcare systems. And I just hope that, with the coming months and maybe year, as people continue to get vaccinated, that we will kind of see our way through this and can look back and really reflect on how we were able to grow through this process.
And Jenkins says it's that teamwork that she has really seen grow and evolve throughout this entire process. In the meantime, Dr. Wenzel says while things are looking good right now, COVID is here to stay, and he expects that we will see confined upsurges each winter, just like with influenza. Working for you in Richmond, I'm Shannon Lilly, CBS 6 News.